Okay, I will now get started with our news briefing on the impacts of mobile technology and regulation in a pandemic. The speakers on this briefing are Katina Michael, professor at the School for the Future of Innovation in Society at Arizona State University, Rob Nichols, associate professor of business law at the University of New South Wales Business School in Australia, and Roba Abbas, faculty of business and law at the University of Wollongong in Australia. We'll hear brief overviews from each speaker and then take questions from reporters. This will be reported and posted on the annual meeting newsroom site. Please use the Q&A function on Zoom to ask your questions. Any follow-up questions or requests can be emailed to media@AAAS.org. That's media@AAAS.org. And now our first speaker, Katina Michael.
Thank you, Colin. I think we'll share our screens. And on this first slide, a focus on what's changed. Well, we're not building technology for commercial purposes. We're building for the public interest. It's this new awareness that we have that our technologies need to respond to the public interest, in this case, a global pandemic outbreak. And how do we respond? Well, country by country, and in some cases, even state by state. When we're designing and we're bringing together a participatory process in the design process, we're looking at a variety of technologies. Let's term these as low fidelity technologies and high fidelity technology. Those high ones actually purport to have a greater potential for failure, and they are riskier in many ways. But if we focus on the low fidelity solutions, those tried and trusted solutions through one pandemic to another, we can look at what we used for SARS outbreaks, the avian flu here in Asia. We then moved on to, of course, MERS and swine flu before that, and today, COVID-19, which is often called SARS Mark II. So with our low fidelity, what do we know? Social distancing works, quarantining works, self-isolation works, the washing of hands, I believe, through many experts in the medical domain, can reduce the risk of spread by up to 30%, if not more. The wearing of standardized masks and their availability in the supply chain is important. Manual contact traces, being able to talk to people and say, well, who did you come into contact with last? Bracelets, and sometimes just plain old PVC wristbands to basically identify that you're in self-isolation, QR codes, and even the centralization of how many masks or how much drugs are available in different kinds of areas like pharmacies. We've seen Taiwan institute an open source system that looks at the identification and the number of masks and how they're distributed across their topology and geography. So the movement from the corporate understanding of revenue generation or cost optimization towards care, governments acting for social securitization. But it's not just an either-or case. Governments are well aware that they require the private sector to actually support. And so while we have this panoply of technologies, this huge selection environment, drones, ANPR, we've got anklet bracelets, the whole lot. What do we do with these? Well, what we're doing is identifying, locating, and looking at condition. And we're using these new technologies and this new visibility to tag, to track, and to trace. And it's all about well-being, not just convenience and care, but control. How do we reduce transmission rates in pandemic outbreaks? But there are some pain points and risks associated with this new visibility, uber surveillance, its public trust, its privacy, data rights, and cybersecurity. Thank you.
Thank you, Dr. Michael. And now we'll have our next speaker, Rob Nichols.
Thanks, Colin. So Katina's looked at some of the issues associated with the different types of technologies. I want to put this in the context of what are we doing with what and for what aim. So to some extent, what we're looking at is what are the issues in terms of inputs, that messaging on hand washing, social distancing, mask wearing, cough etiquette. the technology that's applied to the use and creation of rules. That may be, how do you check into a facility so that people can use track and trace? It might be the technology that's used for tracking in any case. These are inputs, and inputs which were originally designed to create a very specific output. Early on in the pandemic, the output would have been to reduce the likelihood of overloading the health service. As each wave of virus comes through, or viral mutation comes through, again, first step, protecting the medical and hospital service. Second step, to try and get outputs that lead to outcomes. And why do you want to have specific outcomes? Because if you have comparable outcomes between different jurisdictions, that might be between different states in a federal environment, it might be between different countries. By sharing the same outcomes, you can start to create the ability to travel, the ability to engage in deeper economic activity. So, for example, in the case of Taiwan and New Zealand, the outcome of the processes has been elimination. The virus is not in the community there. There are people with the virus, but they're in quarantine and have generally come from overseas. In other countries, such as Singapore and Australia, the outcome is suppression. To the extent that there is any virus in the community, it's well understood, isolated, and suppressed. Whenever there's an outbreak, there is a very rapid track and trace, a requirement for isolation for people who have been designated as being in close contact, typically having been exposed within a few meters or a few yards for a few minutes, or to isolate until you get a test for people who've been casual contacts in the same building, in the same area. And the outcome that comes from widespread vaccination, herd immunity, but where that widespread vaccination needs to have an efficacy related to the R0 or R0 of the relevant strain which dominates at the time. So the socio-technical issues that Katina talked about work to lead to specific outcomes which can facilitate economic activity. Thanks, Colin.
Thank you, Dr. Nichols. And our last speaker, Roba Abbas.
Thank you, Colin. Hello. So I'll be building on Katina and Rob's introductions here by providing an overview of our work that explores the socio-technical lessons learnt from the implementation of mobile and technological applications that were implemented in response to the COVID-19 pandemic and also for contact tracing purposes. Focusing primarily on lessons derived in the Australian case or from the Australian case, but also applicable to a broader international audience. As part of this short introduction, I will draw on this notion of co-design, which you can see on your screen, highlighting the significance of focusing beyond technological or the technological through to the introduction and conceptualization of a dynamic socio-technical ecosystem notion, which I'll describe in a second. And as this notion applies to the COVID-19 setting, I'll also be defining the and emphasizing the value of participatory co-design and deliberative frameworks. As we are aware, in response to the COVID-19 pandemic, as a global community, we've looked to mobile and technological solutions to supplement and aid manual contact tracing activities. And globally, we've witnessed the implementation of a range of apps and solutions, which have varied in terms of their relative success. Socio-technical considerations have emerged as a result. So if we look to the Australian context and some other international contexts, it provides us with insights as to how we can actually design technological solutions. So some of these considerations, for example, some representative considerations include privacy and security. You've got usability and accessibility, ideas around the different forms of creep, and also within the context of the session we presented today, an appropriate regulatory framework to support the introduction of these technologies. An underlying notion here is the necessity of conceptualizing and thinking of things in socio-technical terms, or designing technological systems from an ecosystem's perspective. So we can describe ecosystems from an ecological perspective and in quite generic terms, or alternatively, we can refer to specific types of ecosystems. As an example, we might have a human ecosystem, a technology ecosystem, a digital ecosystem, and so on. What I think, or we think, is valuable is to focus our attention on a socio-technical ecosystem. So we take the idea of social, technical, and environmental interactions as they apply to a given context. And we also supplement this with the idea of an ecosystem that is really dependent on high degrees of engagement. An ecosystem will morph over time and has inextricable links. So we've documented some findings over the past year that compare the Singapore and Australian implementation of the respective contact tracing apps. And what's been highlighted is the value of participation and co-design in achieving a balance between those components that I mentioned, and designing systems that actually support relevant stakeholders. So this involves a series of codes, as you can see on the previous slide, so collaboration, communication, cooperation, and so on. What this approach means, or what does this approach mean in terms of stakeholder engagement? Because really that's what it's all about. Traditional tech design processes focus on a very technologically heavy or technology heavy process with systems engineers, analysts, and so on. In socio-technical ecosystems design and the viewpoint that we've just proposed here, our emphasis is on moving beyond this traditional siloed view of requirements gathering, which is again a process led by technical teams and designers in an attempt to increase participation with a range of stakeholders, whilst working towards our target of co-designing with required stakeholders. And to summarise and finish this introduction, the emphasis here is on designing with, not for, and this applies to a range of contexts. So we can design with at the individual level, or we can broaden out our scope right through to the societal or the socio-technical broader level, the international level even. Thank you, Colin.
Thank you very much, and thank you all. We'll now take questions from reporters. We'll take them in the order received. If you have a question, please type it using the Q&A function and include your affiliation. I'll state your name and affiliation before asking your question. If your question is for a specific speaker, please include who the question is for when submitting. And I'll start with the question. I was just watching your panel discussion a little earlier, and Dr. Michael, in your presentation, you mentioned shiny gadgets are alluring, but do they work? And I think Dr. Nichols, you had an anecdote about an application, I guess a government-funded application that had pretty low uptake. Can you repeat that? What the
Sure.
case is there?
Yeah, so if I want to go into my local cafe, when I go in, I need to use a QR code which registers that I was there, and I'm supposed to check out again. And so it means that if there's a case of an individual who goes to that cafe, then the track and trace people can find them fairly quickly. One of my relatives has Parkinson's disease, and in order to successfully use a phone, he uses a dumb phone. He doesn't have a smartphone, and he is perfectly willing to use a QR code, but his dumb phone doesn't actually allow that. Why does he use a dumb phone? Because the keypad he can manage, he can't actually manage the touch screen of a smartphone. But the effect of the mandatory QR codes on him through a minor disability is that he can't go to the pub anymore. So his social network is excluded by a design that says, well, what's the most efficient way of allowing track and trace to work? Well, it's for people to QR code into where they're going, code back out, And we know we can track where, if somebody who's contagious has been there, we can immediately track who's there. But because he can't use a smartphone, even though he could afford to buy a smartphone, simply can't use one, he can't actually go to the pub anymore. This is one of those issues where if ROBA's co-design had included stakeholders, which include people with disabilities or people in particular groups, then we could come up with a solution that says, well, actually, for some people, it might be that they have a tag, they have some other solution that allows them to continue in their normal life. But part of the issue, and it was, I think, emphasized by Katina as well, it takes time to do some of these things. Getting up a minimum viable product in a few days because you can doesn't mean you should keep it that way. Once you've started to get to the outcomes that you've been targeting, that's when you go back and actually do the job properly. And this is the challenge that that's facing societies now with COVID-19, but will also be a big issue with whatever the next virus is in a few years' time.
Dr. Michael, so what are some of the other, in addition to these accessibility issues, what are possibly some of the more like value-based issues that might prevent uptake?
Yes, the adoption of new technologies in different markets is very much dependent on local values, on local culture, on local interpretation of the value of technology even. How do we utilize technology? Is it more about shiny gadgetry, or is it a process? And we're moving towards longer term responses, becoming more agile and going through that phase from proof of concept to prototyping to what we're calling an MVP, but instead of that minimum viable product, let's call it valuable product or process. Sometimes coordination efforts are more technology than actually shiny gadgetry, and they go hand in hand together with those app rollouts or technological, rollouts. And I think we've got to stop perhaps investing in too much tech and stick with what works and stick with representing all the users, as Rob and Roba have so well iterated today. Where are the people at the seat at the table? The people who are homeless, the people who don't know English, English is a second language, or they're migrants, learning the language, the disabled, those people who feel stigmatized in society by existing processes and applications, perhaps on gender issues. The list goes on. And the question is, how are we reaching the total market rather than perhaps 60% of the market? I mean, in Australia, not every person owns a mobile phone. People share smartphones. Some people are still on feature phones. We can't negate that community. They're every bit as important to this reduction in the transmission of the pandemic as those with smartphones and six-figure salaries.
And Dr. Abbas, I know you've done work on location-based services and regulating those. We have a question here. What about mandatory sharing of location details for individuals who may be concerned about sharing details such as location information with their government? And I might also add, does a pandemic like this, might it change some of those values over time? Might people's expectations change? Might people get more comfortable with this kind of thing? Dr. Abbas.
Very good question or questions. Thank you, Colin, and thank you to who have asked these questions. I think there's a lot to unpack here in terms of the mandating of any kind of technological solution, whether we're focusing on the location component, which is certainly more contentious, or mandating in general. So I'll give an example of the Australian case. Early on in the pandemic, so when our COVID Safe app was released in late April of 2020, there was a lot of some reports that the government would be mandating the app. And that was quickly dismissed, and the government had to make a statement in relation to that, because the citizens here were strongly opposed to mandating any form of app, Now, if you extend that idea to the idea of mandating location, I think you're going to have a lot of pushback. And a lot of that pushback comes from not only the use of location tracking technologies in the context of the pandemic, but what might happen beyond that. And one of the socio-technical, if you like, considerations that we considered was this idea of creep, which quickly emerged and I think is relevant to this point. So the different forms of creep in the first instance, and I'll explain what they are in a moment, in the first instance affect social uptake, but also determine whether individuals are more inclined to adopt a solution. So the concern where location tracking is concerned is whether there will be a shift in mission, for example, or mission creep, where we have objectives that tend to change over time. There's also this idea of scope creep. So while people might be inclined, and this is very subjective and very culturally dependent and context dependent. So we can't give one answer that applies to Australia that then you can apply in another context, for example. There was also concern about scope creep, so project directions and scope changing over time. So I might authorise that my location be tracked for the purpose of contact tracing or to support the manual contact tracing process. But how about if this actually changes over time and the project itself is actually redefined or as part of a deliberate effort? And we know from documented studies and previous examples that this affects trust in government or in authority figures. Function creep was also an issue. So are there any unintended uses of particular information? And that's really tied heavily to the idea of an invasion of privacy. And at the end of that spectrum, the idea of mandating something and creep becoming an issue is the idea of surveillance creep. So the technological system, that location-based system that was initially deployed in the context of the pandemic, actually morphing over time into a tool for mass surveillance. So moving beyond health surveillance into mass surveillance. So it's a very tricky, a very nuanced area, and I think one that requires additional thought. And we believe that one way in which to determine whether individuals are inclined to accept the mandating of a specific app, whether it's location or contact tracing, is to actually engage in these participatory processes and determine what do stakeholders need and how do we define and design systems that work with the stakeholders, or that we design them with stakeholders, not on behalf of the stakeholders. And Rob gave an excellent example of when it goes wrong, or when how it can actually go wrong and cause an accessibility issues for members of the public.
Yeah, Rob and Katina, I saw you both nodding enthusiastically along. Do you have anything to add to Dr. Addis's answer there?
I'll add one example, and that is on tracking. One of the major problems on the tracking side is, how do you persuade people that actually the information as to where they were, for example, when they were with somebody that their family doesn't know they were with, or whether they were at a cash in hand third job, is still important, and it will be used purely for health reasons and tracking reasons, rather than being then used by the tax office or getting back to family members is really important. But how do you persuade people of that, which even when you've got the rules in place that say this information does get ring-fenced within health, that might be a piece of information that you could get across to somebody who was open to it speaking in English. But then if you're actually trying to then get that information over to somebody who has English as their second or likely third language, gets to be very, very difficult. And that, again, it goes back to, why do you need to get the design right, from what Roba was presenting, and why do you need to get the technology right, and the level of technology, a lo-fi solution that Katina mentioned.
I think as well, Rob, dovetailing on that and Roba's comments, is this new visibility that we're living in, this expectation that there is a system that is network dependent, and the end user is that last node on that network. They're the last mile. And now we have all these edge devices that we're carrying with us, whether they be Fitbits, whether they be mobile phones, whatever they are. But the issue here is we need to look at identity in the IMEI, location in those GPS sensors or network determined location, fuzzy to the nearest suburb, perhaps to the street address or to the last town, you know, the last 5 locations you were at. But how often do we poll those devices? Every 30 seconds, every 15, every 5 minutes, every 10 minutes. You know, this information and takes network resources. It's not cheap. And do we track the VIPs more often than we do those who are less fortunate, perhaps? And then this condition element, this criteria that says, what's your temperature level at? What are the symptoms you might be carrying? Are you sluggish today? Have you done how many steps? And all of these 14 sensors in our smartphones determine all of these things. So uberveillance is alive and well. The question is whether we can use the technology for what we need to, pre-process, de-identify, whatever we need to do, store it wisely, make sure we're not.
Looks like we may have lost Dr. Michael. Can you all hear her?
Obfuscating the data. Obfuscating the data.
Can you hear me, Dr. Michael? Okay, I'll maybe move on to another question while hopefully she gets reconnected. We have one here from Gary Sticks for Scientific American. Is there any talk at this point of setting up an international tracking regimen to deal with the next pandemic? Why don't we start with Dr. Nichols?
Well, there's one issue that's going to come up straight away, which is vaccinations. So at some point, and we haven't quite got there yet, in the old days, vaccinations have a nice little yellow card with a stamp to show that we've had yellow fever or different types of vaccinations. And in countries which required a vaccination for entry, you would need to show that. There is a logic to there being an internationally accepted approach to having a single electronic mechanism for showing that you have had a vaccination, which would need to include the vaccine manufacturer, the batch number, first and second dose initially, and when you last had your annual vaccination, if we end up in an annual vaccination regime. Taking that one step further to having some mechanism for tracking within country, I don't think is inconceivable, but I'm not aware of anything that's actually doing that at the moment. It's hard. So I've mentioned QR codes. Well, in Australia, the QR code that I use in the state that I live in is completely different from the QR code system in the second most populous state in Australia. And that's because under federal law, health is done at a state level. So you do have these problems where it leads to an issue again of equivalence, but getting to an agreement as to what is the right internationally focused tracking solution, I think might be quite a lot more difficult than coming up with an electronic vaccine passport that simply records the vaccination that you've actually had.
Did you have anything to add, Dr. Addis?
Yeah, thank you, Gary, for that question. And Rob, just building on what you just mentioned, I think international tracing and tracking is quite difficult for a number of reasons, some of which Rob has mentioned around vaccinations, for example, and the technological challenges of having in different jurisdictions or in different areas, different technological solutions. I think I'll add to that or explain this my response from the perspective of methodologies for engagement, particularly from our experience in the context of COVID-19. So there are other issues and there's not one single answer. So the answer is quite complex here, particularly from the perspective of a technological or a socio-technical solution. So there's not one single approach or methodology that will work in all cases. And if we are looking to do things better, come the next pandemic, which is what the question is referring to, and propose a solution, we need to look at how we actually engage, and engagement is crucial, as is consultation. And in doing so, when we look at stakeholder participation or these collaborative, participatory co-design approaches, we need to really work out a number of things before we actually design a system. So for example, we might look at what unit are we actually focusing on? So Gary, you suggested an international level of whether this would work, but do we need to consider the individual level, an organizational level, and how public enterprises might deal with this? The industry itself and the response. So we saw in the organizational industry level, the Google Apple equivalent of contact tracing that was carried out in Australia, for example, the community level, the society level, to ensure we're encompassing and accounting for all these considerations that are not necessarily technical. So yes, it's really complex. And then that brings us to the idea of who do we actually engage with? So who are our stakeholders of interest? Who are our vulnerable stakeholders? Who do we need to talk to? What are their roles? And how do we actually determine configurations for engagement? So I don't think we're at a point where we can consider an international solution that applies across the board, but it might be worthwhile considering what unit of analysis would work and how we can actually factor in social aspects, technical aspects, and also the environment within which we exist and our technological tracing and tracking solution is being implemented. Thanks, Colin. Thank you, Gary.
Dr. Michael, I'd like to give you an opportunity to answer the same question. I can read it over if you need, or did you hear it?
I did. I think I've captured the gist of it. I think I echo my colleagues' contributions and just say an international response, which we are going to get to eventually, if we want to ensure free travel between nation states, it's going to take international governance. It's also going to have to be proportional. You know, in Australia, we've already seen one of our major airlines basically say no vaccine, no travel when we open borders. And that's been mandated by this airline, a private enterprise. But of course, in consultation, most likely with government agencies. And so is that going to be reciprocated by places Australians frequent back and forth? And how will that be instituted? Is it going to be like this global passport on your mobile phone, you know, where the information is stored on the phone? It's not stored in a government database, a private enterprise database, but on your belonging, your phone, you know, your enclave on your smartphone. The question is, what form may this digital certificate take and what kinds of conveniences it may lend itself to? But as I was showing in this notion of ubervalence, in those three critical dimensions of control, convenience, and care, even if it's in the guise of convenience to travel in the future, even if it's in the guise of care, the underlying dimension is control, so that we see ourselves break away from this pandemic.
And I'm curious also that the question was mentioning, you know, the next pandemic. This is the most major pandemic since you know, the internet and smartphones have appeared. And so I'm curious, you know, what kind of groundwork has been laid over the past year to that might give us an extra leg up over the next pandemic. Dr. Michael, do you want to talk about that?
Just briefly before I pass on to Roba and Rob, we're learning from every encounter. You know, the deployment of an SMS web-based phone in 2003, this web-based solution, which was, if you want to incorporate yourself and dial into this, SMS this number and we'll let you know when you're approaching a SARS-infected building in Hong Kong. We then saw electronic bracelets being instituted in Singapore in hospitals for tag, track and trace to ensure that people visiting hospitals while people had SARS were not going to spread the disease onwards. And so from RFID, radio frequency identification tags and cards, right through to this network-based solution, you know, which could actually support services. We've seen different deployments, but I think we are learning from every experience. Taiwan has been a great case. South Korea has been a great case where there's been heavy involvement of pandemics over the last 20 or so years. And so we are learning as a community. We are getting on this next generation of services. But I think what we're going to do is regress in some way and rely on those things that do work, like QR codes. This is what's plentiful in Australia at the moment. Check in, let us know where you are, and manually we'll determine anything if need be. You know, no one's really using the app, though we've all got it installed. I think I might pass on to Rob or Rober now.
Colin, if I may, I might move to Megan's question. Is that okay?
Sure.
So this is whether there are other project types where large-scale technological systems have been considered, like they've been used for COVID-19, and where you think practitioners are watching from and learning from what we're finding with contact tracing now. I'm going to repeat an example that I gave during the session that we just had, and that is how one of the learnings that that Australia had, and I think has been seen in other countries as well, on contact tracing is, well, what software do you use to help the tracers to work out where people have been? And something somewhat better than a spreadsheet and a series of maps with some pins in, which is not terribly transportable, but was used initially, for example, in the UK, which is one of the reasons they gave up contact tracing very quickly. In Australia, the primary contact tracing software that's used is actually customer relationship management software, so it's Salesforce. One of the key things that made that work is, and you can look it up, if you go to the Salesforce website, and I'm sure other CRM providers do the same thing, they offer an online contact tracing training system. So what's important there is that the people who are doing the contact tracing aren't detracted or distracted from their work in contact tracing, training up the more contact tracers that they need because they're being overwhelmed, because there's a primary induction being provided by the technological partner. So I think this is one of the ways that you'll start to see post-COVID implementation of other bits of major software that start to say, well, actually, we can train pre-induction. And training pre-induction, as long as it's well-designed and appropriate, still using the learnings that Rober and Katina have talked about, will actually lead to more effective implementation of that software. So this is a very general thing, but I think there are a range of lessons that are being learned in the implementation of COVID-19 tracing, which are actually going to be applied in the way that large-scale software deployments are done in the future. Unfortunately, I think the other thing that both Katina and Rober and I have discussed, which is trying to stand up a software solution to what is really a minimum viable product rather than the minimum valuable product that Katina meant, is also going to be an outcome that, yeah, you can actually put up a system like the SMS system that will get results of COVID testing out to people who sign up for an SMS within a few hours, well, within 1 hour of the test results coming back from the pathology tests. And unfortunately, some of that will not take into account the great design principles that Rober has outlined.
Dr. Abbas, did you have anything you wanted to add to that?
Yeah, I might backtrack actually, Colin, and look at the specific lessons themselves that were derived from at least the Australian and some of the international cases as well. So the predominant issue, I think, or the issues were around trust, privacy and security. And they were the dominant themes, at least in Australia and also internationally, in terms of the public discourse around COVID-19 technological solutions. Everything was presented in terms of a trade-off. And I think next time around, we've learned from that lesson that trade-off or the trade-off mentality isn't necessarily the best way to propose things. So if you look into the work of, for instance, Anne Kavukian, where we look at positive sum arguments, so we don't need to have either or. So we don't need to forego and trade our privacy for access to a service and for health and safety purposes. So this trade-off notion, I think we've learned a lot from positioning these technological solutions and how we actually implement them into the market. Another theme which we've already raised around usability and accessibility. So how do we account for vulnerable groups in the future, or vulnerable individuals who perhaps use older technological solutions, do not have access to services, can't operate the solutions, those who do not speak English or a specific language. So these usability and accessibility considerations are going to result in a digital divide if we do not think of them in a careful way. And this disparity is quite problematic into the future, particularly if we're looking at large scale or international responses. So we want to attempt to avoid this idea of digital discrimination based on those that have access or not. And Rob provided such an excellent example today of not being able to frequent a pub, for example, due to the inability to scan a QR code, which is currently mandated in Australia, or excuse me, in New South Wales, which is the state that we currently reside in. And in addition to this, I think lessons around technical and functional considerations and lessons from international implementations. And in our scientific session, the live session, I drew on an MIT Technology Review article, which looked at some of the success stories, some technological solutions that were abandoned, and tried to compare what the underlying themes were. And they were not to do with the technology, they were not to do with the response itself, but rather the management of expectations and the degree of integration with the manual contact tracing processes so that they are seamless. And there's many more lessons that we can draw on, but I think in the interest of time, I'll stop there.
Oh, sorry, I was muted. We have about 4 minutes left, so not too much time. If you have anything you'd like to wrap up with, go ahead, but I would maybe like to give each of you the opportunity to answer, you know, what does these co-designing principles, for example, that Dr. Abbas you were talking about, what does that look like practically? You know, what should you know, the stakeholders you're mentioning, how should they be engaging with this kind of process?
That's a very, very good question, and I'll try to be as succinct as possible with my response. So in terms of stakeholder engagement, I think we need to move away from the operational view of stakeholders or the end user view to a broader stakeholder set. And this ranges, obviously, we still do include our operational stakeholders, designers, developers, but through to the non-technical, the vulnerable groups we're speaking about. And there's a really good question in the chat of how do we engage with these stakeholders? Well, I think first of all, we actually listen. We listen to their needs. We define their roles, the nature of engagement, and we observe, or we determine whether they will be contributing to these processes as an observer right through to a design partner. So there are a range of configurations and a range of methodologies that are available at our disposal, ranging from minimal input right through to high degrees of input. Now, in terms of the methodologies that are available, how do we align those methodologies with the stakeholders and their degree of input? And that's going to be a challenge. And I think one way that we can achieve this is through transdisciplinary approaches, where there are emergent, theoretical, and practical. As you mentioned, it's important to be able to operationalize these theories, practical approaches for engagement. So we've got different types of way we can engage. There's cooperative design processes, you have participatory design, you have consensus participation, but Colin's very much context dependent and requires us to conceptualize our ecosystem, determine the components, identify the stakeholders of interest, identify their role or define their role, and then engage in those methodologies and iterate and continually touch base with our stakeholders. And that's sort of the short summary answer.
Dr. Michael, anything to add before we wrap up?
I just echo Robert's sentiments and say also additionally co-design and participatory design, participatory action research is hard. If done well, I mean, too often commercial entities are paying a lip service to this process just to sell a product. And what we're talking about here again is public interest technology. It's not about selling a product, it's about engagement. And sometimes we can raise awareness levels through the engagement, not even the product or process we're creating, simply through dialogue, simply through deliberation, simply through being together. And sometimes we do have to look at who the powerful players, who are the powerful stakeholders, create pain chain charts. What are their pains? What are the reasons for the pains? How can we overcome these pains towards a value proposition that works for everyone? So I'll just summarize there and say co-design is not easy. How many touch points do we have with these stakeholders? But we're about creating new methods, new design approaches to serve the public interest in terms of technology.
And Dr. Nichols, anything to add?
Yeah, no, the co-design isn't easy. I think is really critical. But I think what it means is that you need to actually spend money and time and effort to make sure that the relevant stakeholders are engaged, and that spending money is actually probably the hardest part, particularly for the private sector, to get its head around in terms of ensuring that you have the right stakeholder groups involved.
Great. Well, thank you, Dr. Nichols. Thank you, Dr. Abbas and Dr. Michael. And thanks to everyone watching for joining us today. If you have any follow-up questions or requests, you can email media@AAAS.org. The next briefing will be tomorrow morning at 9 a.m. Eastern Time. It will be on the topic, They and We Are What We Eat, linking diet and gut microbiome to human health. Thank you all for joining.
Thanks, Colin.
Bye-bye.